course, as soon as it goes live, Marley starts barking. Marley, come on. Good boy. All right. All right. Hey, everyone. Welcome to another Rebel Health Tribe interview. We are joined by microbiologist Kiran Krishnan. Kiran, how's it going?
Great. How are you guys?
Awesome. I feel like we do this all the time, probably because we do this all the time.
Yeah, usually.
Today, some of you might know Kiran is our guest expert on the microbiome series, which is awesome. If you haven't watched that, I would highly recommend checking out those webinars. They're available in the free member area, in my dashboard area, if you're going to go look for that. But all the replays are there. It's like 15 hours now of crazy microbiome information. And today, though, we're going to talk about a little bit different of a subject, and that is proteolytic or systemic enzymes. Can you explain what that means a little bit? What is proteolytic or systemic enzymes?
Yeah, so the word proteolytic means that it breaks down proteins and in a variety of ways. Every proteolytic enzyme has a different target within a protein structure itself, and so it creates a different product once it cuts up the protein. And systemic enzyme is one that has the capability of being absorbed into the body and then perform functions throughout the body. Digestive enzymes, for example, work primarily in the digestive tract and don't really do a whole lot in the rest of the body. Systemic enzymes do somehow get through. And there's some overlap. There are some digestive enzymes that seem to have systemic effect as well. So we'll talk a little bit about each of those.
What would determine if they have an effect as a digestive enzyme or as a systemic? Like, would you take it with or without food?
So if it's a known systemic enzyme, then you want to take it without food to encourage the absorption, because if there's any food present in the gut, then the enzyme will start going to work to actually break down the food itself. But if it's a digestive enzyme, obviously you want to take it with food. And the ones that double as both systemic and proteolytic, like pancreatin, for example, if you have pancreatic insufficiency, you might need to take it with food and a dose without food as well, so you have both the benefits.
Okay, that makes sense. I'm going to go down a list of commonly used proteolytic or systemic enzymes and other ingredients you might find in a product that contains proteolytic and systemic enzymes. And we can just go through each one. Some will just be short, some a little bit more info on what they do, what the functions are, why someone might want to take it, or what the benefit might be, and if there's anything specific they'd want to look for regarding that specific enzyme.
Yeah.
Okay. I'm going to give a little cut break. I'm going to just give about 10 seconds between each one, at least for Joe.
Okay.
Okay, first off, we have protease. Now, this is one that you'll likely see in digestive or systemic enzymes, correct?
Yeah, and if it just says protease or acid-stable protease, that means it's a kind of a generic protein digesting enzyme. It more than likely will be more beneficial for breaking down food, because most of the well-known systemic enzymes have been branded or have names that are more specific to what they do in the body. So protease just means an enzyme that breaks down proteins. Having a variety of proteases is important. So people need to understand that protease doesn't mean it breaks down protein in the same spot. So every protease enzyme has a different place within an amino acid chain that it actually cuts the amino acid. And so in many cases, you need a series of protease enzymes to break down a full big piece of protein into its original amino acids that you need to then absorb and utilize. So first, you need a protease that cuts it into bigger pieces. Then you need another protease that cuts those bigger pieces into little pieces. And finally, the peptidases break it down into tiny peptides and release the amino acids.
Okay, that makes sense. So protease is more of a general term of an enzyme that breaks down protein versus a specific enzyme.
Exactly. Yeah, protease is just an all-encompassing term. Most of the systemic enzymes we'll talk about fall under the category of protease. So just the word protease just means a protein digesting enzyme.
Okay, perfect. Thank you. Hi, Joe. All right, the next one is superoxide dismutase. Now, or SOD. I've heard this discussed a lot in discussions involving detoxification and oxidative damage or things of that nature. Why might one find superoxide dismutase in a systemic enzyme product, or why would it? What does it do? Why would we want to take it possibly?
Yeah, so SOD is really important. So our body produces SOD as well to some degree. Our cells do. SOD is a enzyme that actually breaks up superoxides. So superoxides are a byproduct of respiration. Respiration is the metabolic activity that our cells do, where we use oxygen to create ATP. Now, oftentimes, what you get as a byproduct are these superoxides. These superoxides are very oxidative, they're very corrosive, they can create cancers, they can damage tissue. In fact, you increase your superoxide levels when you exercise. So exercise, for example, is something that increases superoxide and what we call oxygen-free radical damage. Superoxide dismutase is there specifically to quench these superoxides and reduce the tissue damage. So it becomes very important for somebody who has a lot of inflammation, joint damage especially, or is just coming back from an injury of some sort where you had a joint injury, surgery, where there's a repair going on in your body. Superoxide is very important for helping with the repair and eliminating the oxidative stress that happens in result.
Okay, that makes sense, and that's why people that have been overtraining for years, they tend to look more aged.
Yeah.
Is that that's the oxidative damage, oxidative stress, so it could potentially help with that type of situation?
Absolutely, yeah. I know training is very important, but training without the proper nutrition also then doesn't help your body replenish what it needs. Oxidative stress goes way up when you exercise and put your body through a lot of stress, and you need the SOD to bring it down.
Would that work or apply to the SOD? Any type of, because there's other, exercise and training is definitely one source of oxidative damage or stress. But what about things like smoking or chemical exposures and things? Would this be something that would help with all forms or sources of oxidation?
Yeah, and even just normal existence, even just normal breathing creates superoxides within the body. It's all part of cellular mechanism, cellular metabolism, and so low SOD levels will lead to chronic inflammation and chronic tissue damage. Certainly, exposure to chemicals, like people who smoke or drink quite a bit, will have a lot of superoxide production in their livers. Anytime you're stressing an organ, you'll get superoxide production, and the SOD becomes critical in disrupting that.
All right, that makes sense. Sounds like some good stuff. We'll go on to the next one. All right, bromelain is an enzyme that I know comes from pineapple, or it's found in pineapple. It's probably also found other places, maybe, but that's about all I know about it. Is that I find it in digestive enzymes, and then it's found in pineapple. Can you share some more with us?
Yeah, and in fact, it's found in the core of the pineapple more. So if you were to try to get your bromelain from eating just pineapple, if you're not eating enough of the core, then you're not getting a whole lot of bromelain out of it. But it does come from pineapple, and actually in Hawaii, it's used as a medicinal food quite often because it's well known to help with things like allergies and injuries. So people have a wound, they might actually put some pineapple on it. They use it to help tenderize meat to some degree because it does have proteolytic activity. So when you put it on meat and let it marinate on meat, it breaks down some of the muscle tissue in the meat to tenderize it. But what bromelain is most well known for in the studies is its anti-inflammatory effect and its digestive effect. So it's one of those that also acts as a digestive enzyme. It helps you break down proteins in the digestive tract. if you're eating a lot of proteins and meat. But when you take it on an empty stomach, it can get absorbed and act as a powerful anti-inflammatory systemically. And then there's some studies on its ability to modulate the immune system. There was one study that was done that showed that it actually reduced allergy and asthma reduction in some patients versus a control. And lastly, bromelain has also been shown to have some anti-cancer effects, which are very interesting. It seems to be able to target cancer cells and some of the protein coat that protects cancer cells within the body. It seems to be able to digest that protein and expose the cancer cells to the immune system.
That's interesting. I only knew about a quarter of that. So that's it sounds like pretty versatile. There's probably a reason why you find it in almost all systemic enzyme blends and digestive. And it sounds like it's pretty well researched then too.
It has been around for a long time. So bromelain has a pretty good amount of studies behind it.
You said the core of the pineapple. Have you ever eaten the core of the pineapple?
Only when I've put it through my masticating juicer. Yeah, that'd be the only time. But other than that, no, not usually.
I didn't know if it tastes like the fruit part does, or if it's just, I don't know. I'll have to try that sometime. So I would guess pineapple juice, fresh pineapple juice, would have plenty of bromelain, but probably not. You don't know what you're getting if you buy like a can or a container.
Right. Yeah. Exactly.
All right. That's great information on bromelain. We will go on to another. Looks like serapeptase is up next. This is one that I generally haven't seen in many blend and systemic enzyme blended products or combo products. I've always acquired it on my own. I know Sera Gold from Enzymedica is a really popular serapeptase product. I think this might be one that is a little bit more dramatic research and information out there about. So can you share with us some of the information with serapeptase?
Sure. So serapeptase is actually interesting because it's somewhat of a controversial enzyme in the enzyme world itself. There are groups of people that are huge proponents of it, and groups of people that really feel like it hasn't been studied well enough. Serapeptase can be made in the gut, so it can be natural. There's a bacteria called Enterobacterium serratia that can exist in the gut and make the serapeptase for you. But it's typically found in silkworms, and it's the enzyme that the silkworm baby makes to break out of the cocoon. It's what digests the cocoon when it comes out, and it's actually, I believe, serapeptase is a prescription drug in Japan, and it's known to have anti-inflammatory, anti-edemic effects. If you're familiar with edema, so it improves vascular, fluid retention. And then the last thing is analgesic effects. So some people use it for pain as well. There's probably, if you look at the literature, I've looked at review literature on serapeptase. There's probably about 48 studies done on serapeptase. A lot of people question some of the studies, but there are certainly studies that show benefit. I actually think serapeptase is a good enzyme to have. It has enough systemic benefit to it. There's certainly no harm in it. So it could be, it's a good supportive enzyme to have in a systemic enzyme blend.
Cool. Yeah, that was actually the first systemic enzyme I was ever introduced to, was that Sera Gold product from Enzymedica. And a lot of the combo products of systemic and proteolytic enzymes are very expensive. And when someone's looking, if I work with someone that has, like chronic joint pain, aches and pains, inflammation, arthritis, stuff like that, if they're on a budget and they want to try systemic enzymes, I would generally go with the Sera Gold or the serapeptase or a serapeptase product first, and see if they get results from it, if it is helpful for them before going down the rabbit hole with the giant product in the higher price point. Sure. And I'd say 2/3 of the time, maybe not 2/3, but at least half of the time, I saw pretty good results with that.
Yeah, I mean, I've seen it. I've known a lot of people that work with it. I know, people like Dr. Gary Gordon. I've been to his conferences quite a bit, and there've been a number of really good speakers that are huge users of serrapeptase. They've seen a lot of great results in chronic fatigue and fibromyalgia. So I've been to a lot of presentations where they talk about its effects. So I think personally it's a good enzyme to have in a formulation.
Great. All right. All right. Here is what's probably the star of the show, possibly. I'm not sure, but definitely something you have a lot of experience with is nattokinase. And there's a lot of specifics with nattokinase. I know you have a lot of experience working with it and in that field with the bringing nattokinase to the United States about 15 years ago or so. I've heard you mention that. So what is nattokinase? What does it do? What's the research? And what are some specifics? There's different forms of it, I believe, or sources. So what are some specifics people might want to look for?
Yeah, so nattokinase is fantastic. Actually, the way it was discovered was from the fermented food natto. In Japan, there's I think it's the eastern part of Japan that consumes this food natto for breakfast every day, and it's basically spoiled soybeans. And the soybeans are fermented by Bacillus subtilis, which is something that your audience is now very familiar with through Megaspore. And as it's fermenting the soybeans, it produces this really sticky peptidoglycan, slimy, smells like old gym socks. I mean, it's a horrific thing to have to try to eat. But certain people have a real profound acquired taste for it. They even get natto rolls in certain Japanese restaurants in the U.S. You can get natto rolls, sushi rolls with it in it. So the backstory of nattokinase is interesting. There was a warrior called Miramoto. Miramoto was one of the nomadic samurais, very well-known samurai in Japanese folklore and culture. He was credited as the first person to actually try the food natto. And so they always say it took the bravery of a samurai to try to eat that food because it's so horrifically the smell and the taste of it. And basically the way it came about is, the samurai used to carry their soybeans that they would use as food in these wheat sacks and on the side of the horse. And they would travel long distances. And then the Bacillus subtilis that's in the environment and in the ground would contaminate the soybeans that's in the wheat sack. And when it was hot outside, it would rain and there's enough moisture, it would ferment it. So they would open up the wheat sack that's carrying the soybeans and find it to be spoiled. And they started the samurai started feeding the spoiled soybean to their horses first, because of course they didn't want to eat it. And what they found was their horses were getting significant benefits from it. They were seeing increased strength and endurance and all that stuff. So Miramoto was the first samurai to actually dip his finger and try the natto himself. And it became a traditional food in Japan for the last 2,000 years. Japanese doctors actually prescribe the food natto for a number of indications. Number one, they prescribe it for high blood pressure. Number two, they prescribe it for preventing senile dementia. They prescribe it for high viscosity in blood, which is something interesting we'll talk about. And then they also prescribe it for people who tend to have a high state of blood coagulation. So they are pro-coagulant, and they develop DVTs and things like that. So what nattokinase is the main enzyme that's found in this food natto. It was isolated and studied by a doctor named Dr. Hiroshi Sumi. And what he figured out was it has fibrinolytic activity. So it has the ability to break down fibrin in the body. That's one of the things it can do. So fibrin is basically like a soluble fiber that floats around in the blood. And when you have too much fibrin in the blood, and fibrin is actually the basis for creating blood clots, so that it's always floating around in the blood, and until you get a cut and the whole cascade of blood clotting triggers, fibrin is just kind of swimming around waiting to start forming clots. So some people will tend to have high degrees of fibrin within the blood. And when you have high degrees of fibrin in the blood becomes actually quite viscous. And the viscous blood becomes harder to pump for your heart, for one, because it's harder to pump a high viscosity blood. Imagine pumping ketchup versus water. And then also the blood becomes more abrasive. So in the areas where you have arterial bifurcations, you have an artery and then it bifurcates into two. That little center part of the arterial bifurcation is where the blood hits, at a high viscosity. And if the blood is abrasive, it creates damage to that inner lining of the vascular system. And that's where you tend to see plaques forming, arterial plaques. So the research that I've done with nattokinase, I did a couple large human clinical trials with nattokinase a decade ago. The first one was on blood pressure. We saw in 30 days, significant drop in blood pressure. That, of course, makes sense because if you're reducing the viscosity of the blood, it reduces the pressure in the vessels itself. The other thing that we saw is it actually reduces the viscosity of the blood and improves blood flow. So we use something called a Rheologics viscometer that measured the blood moving from one vein into the machine and out into another vein. And it was a real-time measure of blood viscosity, totally reduce the viscosity of the blood, improves blood flow to all your organs, to all your tissues and all that. So overall, great for the heart, great for blood circulation, seems to really help people with varicose veins and spider veins. It's great for people who tend to get DVTs and other types of edema, and great for preventing senile dementia as well. And in all my studies, we found NSK-SD is a brand of nattokinase that meets the original nattokinase that was discovered by Dr. Sumi the most. There are a lot of fake nattokinases out there, which is unfortunate. So if you see a product that says nattokinase on it, you can potentially be buying one with one of the many fake nattokinases. The only one that I've seen that's actually a true nattokinase is NSK-SD is the name brand, and that's a more expensive version, and hence people have made cheap replicas, but that's the only one that has got the clinical trials behind it.
So, wow, I thought of a few things to say, but then you kept explaining more awesome things about nattokinase, and I forgot a couple of them. But what I gathered out of that is it will turn me into a samurai.
Yep, exactly. So, that's it.
Perfect. Yeah. Okay, but awesome for heart disease and for blood pressure and for fibrinogen is the marker on blood test that measures that, or is fibrinogen and fibrin different?
Fibrinogen and fibrin are different. So soluble fibrin is the activated form of fibrinogen. So it can change fibrinogen markers too, but we basically focus on soluble fibrin because that's what ends up making the blood thicker.
Okay, so blood pressure, circulation issues, great for cardiovascular. What about
and brain health? Brain health. So it's used a lot in Japan to prevent and treat senile dementia.
Okay, what about people with blood thinners? People on blood thinners or people with clotting issues or people on medications involving circulation already? Should they be wary of or careful with nattokinase? Should that be worked with a practitioner, or what's the safety there?
Yeah, anytime you're on a blood thinner, you should definitely work with your practitioner. Nattokinase doesn't seem to affect the body's ability to produce a blood clot. That is, anticoagulants work on thrombin. Thrombin is the main protein that's responsible for creating the lattice of the blood clot, and it's a cascade, actually. Nattokinase doesn't interfere with that cascade at all. It seems to just reduce the amount of soluble fibrin. We hadn't seen any issues in the trials we've done, but anyone who's on anticoagulant therapies already got a sensitive rheology going on, so definitely talk to your doctor about it.
What about blood pressure medication?
What about blood pressure medication?
Because that's different than blood thinners. I mean, blood pressure medication, since the nattokinase has been shown to lower blood pressure, would they also then want to talk to their physician and see it might reduce necessary of a dose? Or have you seen people, and we're not giving medical advice, FDA, everyone else, have you seen people replace blood pressure medication with nattokinase?
Yeah, that's what we did in our study. So we did I think it was a 68 or 70 patient study with people with hypertension or pre-hypertension, and what we were able to see is a significant enough reduction in both systolic and diastolic pressure that matched that of high blood pressure medication, beta blockers, things like that. And in fact, after the study was done, many of the patients wanted to continue on the nattokinase instead of blood pressure medication. So we have seen those benefits, but like Michael said, again, if you're taking blood pressure medication, don't stop it and take this. Talk to your doctor about it. You might be able to take both at the same time and then adjust dosing of your medication as needed.
And there are studies available that show this blood pressure reduction capability of nattokinase.
Yeah, and it's actually specifically on the NSKSD form.
Okay. Well, if somebody wants to see that, reach out to us, and we'll get a link to you for the actual research on it, or maybe we could find a study or two and post it with this video potentially. Because if you're gonna go talk to a doctor, you're gonna want to bring something like that with you. So great, that's awesome stuff. I figured that was going to be the star of the show, and it probably is.
Yeah.
All right, we've got a few more. We got pancreatin.
Yeah.
Pancreatin is another one I think I see in digestive enzymes that's also in systemic enzymes, and I'm guessing, this is my physiology genius at play here, that it's produced by the pancreas.
Yeah, yep, exactly. Yeah.
Awesome.
It's and pancreatin is actually kind of a collection of a few different enzymes. Their primary role is for digestion. Your body secretes a couple liters of pancreatin throughout the day into the duodenum itself through the pancreas. Their primary role is in digesting food and breaking down carbohydrates and fats and proteins. Some pancreatin can be seen to be used systemically as well. So it tends to become important people who are above the age of 25 to 27, because studies show that once you've reached 25 to 27, your body's ability to make pancreatin actually starts to drop. And so you actually get lack of digestion of your food, and that actually will create more stress on your pancreas, because it tries to keep up with the production of pancreatin. And when you create stress in your pancreas, you're also creating stress on the islet cells. Islet cells, of course, are the islets of Langerhans cells that produce insulin. So there's a correlation between overeating and the development of type 2 diabetes and killing off your islet cells, because your pancreas is trying too hard and undergoing a lot of stress to try to produce enough pancreatin to break down the food. So especially if you're over the age of 25, 27, certainly in your 30s and 40s, it's important to take some pancreatin. If you have any pancreatic issues like pancreatitis, or other diseases that affect your pancreas, or taking medications that affect your pancreas, pancreatin is important as well. One note to keep in mind is there have been some reports of people that have allergic reactions to pancreatic enzymes or pancreatin that's found in enzyme products. So, when you take an enzyme product that contains pancreatin, start with a small dose first. Take 1 or 2 caps. If the dose is 3 or 4 caps, take half or a quarter of the dose, just to make sure you don't have an allergic reaction to it. The allergic reaction is rare, but just a precaution.
Okay, that makes sense. Also for diabetics then too, probably, since diabetes, blood sugar, pancreas, probably a good addition.
Yeah, absolutely.
Okay, trypsin is the next one up. Yeah. I don't know anything about trypsin.
Well, so trypsin, although the name doesn't suggest it, is also made by the pancreas, and it's actually released in an inactive form, and is actually hydrolyzed by stomach acid to some degree to the active form of trypsin. And trypsin is primarily, again, a digestive enzyme. It has a very specific role in breaking down large chains of protein to smaller chains of protein, so that your body can actually start the breakdown process to release amino acids so you can utilize it. Trypsin plays a very important role in that. But trypsin also has been shown clinically to work well against things like osteoarthritis and reducing joint inflammation. So there is a systemic impact on trypsin as well. It can be absorbed into the circulatory system and seems to help with joint pain. There are some places, and actually there may be a prescription drug that uses trypsin as a paste form to put it on wounds, because it helps with wound healing. It actually breaks down some of the scar tissue formation and things like that to actually help with wound healing. So I can't remember where. I don't think they sell it in the U.S. So it might be in Asia or in Europe where they have these the trypsin-based wound healing creams, which are prescription products. And some people say it has some antimicrobial effects as well, so it helps keep the wound clean. But trypsin is an important enzyme. Again, as your pancreatic function drops as you age, you're not producing as much trypsin as well. So it becomes, certainly if you're in your 40s, 50s, 60s, it becomes quite important to look at a product that contains trypsin.
Okay, that all makes total sense. I'd never heard of the wound creams. That's interesting.
Yeah, it seems to help modulate with it. So there's another thing, matrix metalloproteinases, right? So matrix metalloproteinases are abbreviated MMPs. Matrix metalloproteinases are types of proteinases that actually affect tissue remodeling. And nattokinase has been suspected of being able to affect MMP activity. Same with trypsin and chymotrypsin. So we've had people report to us before when using trypsin, chymotrypsin, or nattokinase that they see scars that they've had for a long time diminish to some degree, because that's one of the roles of matrix metalloproteinases, is to remodel the tissue so it reduces scar formation, and that may be part of the benefit of putting it on a wound as well.
It's fascinating how many, like, you think one enzyme, one function.
Yeah, you know, they do so much, and they're also specific in what they do.
It's just crazy. The further we go down all these rabbit holes and things, the less I feel like I know. And it's funny because it's like running around in a cave with a flashlight.
Right.
And you can see what you're looking at right now, and then you think, oh, I've got this all figured out, and you look up and there's bats.
Yep.
So, all right. Next up, I'm going to give a break. I'm doing pretty good with staying on like a thing. Joe will be more happy.
Awesome.
I try to make his life not hell editing all these videos. Right, Joe?
Shout out to Joe.
Okay, next up we have peptidase. Again, my knowledge on peptidase is very lacking, so I have nothing clever to add at this point.
So peptidase is also a type of protease enzyme, which means that it breaks down proteins. But peptidase is responsible for taking the mid-sized chunks of proteins that have now been broken down by things like trypsin, and break it down into peptides. So peptides are much smaller chains of amino acids, usually around 2 to 8 or 9 amino acids together. Peptidase is responsible for cutting them down into those smaller peptides, which eventually will release the free amino acids so your body can actually utilize it. Peptidase is also important in breaking down proteins that could cause allergenicity. So most people know proteins are the trigger for allergic reactions, and only proteins that are of certain size can be an allergen trigger. So proteins that are 10, 11, 12, 13 amino acids long are typically the ones that cause allergic reactions. So the peptidase is there to break that 11 amino acid protein string down into a 6 and a 5, then it reduces the allergenicity of it. So I'll give you an example of where they use it in industry. A lot of people have latex allergies, right? And so a lot of people who work in the healthcare, you might know somebody that works in healthcare with blood and guts and wears latex all day long. Some people with latex allergies will tend to have a reaction to the latex protein on their skin, so they get all these inflammation in the dermal layer. If you treat latex with a peptidase enzyme, you break down the latex protein enough so that it actually doesn't cause an allergic reaction. So there are some peptidase treated latex that doesn't cause an immune reaction. Certainly there's patents out there and all that on it. I actually worked with the professor out of University of Wisconsin-Madison who was working on that patent, and that shows you what peptidase does in the body. But it's very important to get to the free amino acids.
That's interesting. I did know what it was a little bit. I just didn't recognize it because I've never read it before.
Yeah.
The actual word. I'm reading the list of proteins or the list of enzymes off the screen, and I'd never seen it spelled. And so, yeah. So it's is peptidase a general term like protease? Are there multiple
Yeah.
peptidases? And so the proteases break down the big proteins into smaller, and then the peptidases break those down into even smaller. And with
Yeah.
food sensitivities, especially, and reactions to it's the protein in the food. So, say like gliadin, for example, a full gliadin molecule may trigger a reaction, whereas if it's broken down into 4 pieces, then it wouldn't.
Right, exactly. Yep, and that's true. And even among peptidases themselves, they have different targets. So if you've got a peptidase that only breaks down at lysine and glycine or something like that, then you're only breaking down certain fragments. So you need a variety of peptidases that breaks down in different amino acid targets.
Okay, that's interesting. It makes sense. So peptidase would be found in digestive enzymes then too.
Yeah, important in digestive enzymes.
Okay. We got only a few more. So break. This product is really loaded.
It is, yeah.
I hope that they give me at least some of the breakdowns. I wrote down a few to ask for, and I'm going to see. I seem to have some sort of leverage over there at this point, so we'll see if they'll give me. I tell them I'm not going to make a product, so don't worry. Okay. Amylase, and I can gather that it's specific to break down something that the medical terminology would be AMYL, but I don't know what that refers to.
Yeah, so amylase breaks down amylose, which you're right. So amylose is a type of carbohydrate, a type of sugar that you'll find in rice and other grains and in many vegetables. So in potatoes and things like that. So amylose and amylopectin are the 2 types of sugars or carbohydrates that polysaccharide carbohydrates that make up a lot of the vegetable parts and grains. And so amylase is very important to break down any kind of grain or vegetable. And in fact, your body produces amylase in your saliva. Amylase is the only enzyme in the saliva, and part of the chewing action is what will break down the fibers in the foods, and then it gets exposed to the amylase in the saliva itself, so it starts the breakdown process right in the mouth. And then as it passes through the gastric system, most amylases will tend to be somewhat stable, but will die off to some degree through the gastric system, and then you have amylase again being produced in the small bowel to break down the food. So amylase is very important for carbohydrate digestion.
So would be found in both systemic and digestive enzymes.
Yeah, amylase is interesting because there's not a lot of studies to show its effect systemically.
Okay.
But certainly, if you're not breaking down your foods well, and you're not getting all the nutrients out of it, you're certainly going to have systemic issues, and especially foods like vegetables, which are very important for you. So it'll be found in a systemic enzyme. It could be, but that may be one that's important to take with food as well.
Okay. Great. And that's interesting. It's in the saliva. I thought there was more enzymes in saliva, I guess.
Yeah. There's many different types of enzymes. Yeah, but amylase is kind of a general.
Another general term.
Yeah.
Okay. Okay, and here's one that I hadn't heard of until this morning, and I've been doing some research on it today, and it seems to be something, 1, I probably should have known of before, and 2, a very powerful potential enzyme ingredient. So it's C-Pros, and I've been reading some, but I'll leave it to you to explain what C-Pros can be used for, what its functions are, and if there's any specifics related to C-Pros.
Yeah, so interestingly enough, I worked with C-Pros 10, 15 years ago, and I was in a group that was actually looking at making C-Pros a prescription drug here in the U.S. for cystic fibrosis patients. So C-Pros is a very, very powerful protease. in its pure form, when we were working with it, we're working with it in its purest form. In its purest form, it's so powerful that actually, if you took the powder itself and put it on your fingers, it would actually rub off your fingerprints. It's that powerful.
That's
So
awesome.
yeah,
I mean,
it's
good to know in case I take up a life of crime.
exactly. So there's a scientific way of eliminating your fingerprint identity. But Ceoprose is a great expectorant. So people who have a lot of mucus buildup and all that for sinusitis and upper respiratory infection, it's great to break up the mucus, and it's a great expectorant as well. It causes the mucus to come back up. So you can get rid of it out of the body. It's very powerful anti-inflammatory. And there's some studies show that it helps break up uric acid as well. So people with gout and overabundance of urea, there's some studies that show that it does that too. But what we were trying to do is get it approved as a prescription drug for cystic fibrosis patients who have trouble with their airway, and they produce a lot of mucus and things like that they can't get rid of. And so it's a very powerful anti-inflammatory, systemic anti-inflammatory enzyme, great for upper respiratory health, great for anyone with sinus infections. And it probably does a lot more than that. It's just it's used as a prescription drug in Japan for inflammation and also for joint and pain in Japan. And I think it's used for cystic fibrosis in Japan as well.
I keep hearing you talk about how the bacillus spores are used as prescriptions in Europe. The nattokinase is used in Japan, or the natto itself is prescribed in Japan. The Ceoprose is prescribed in Japan, and we get Nexium.
Right, exactly. Mucinex, Nexium.
Yeah, Mucinex, Nexium. We get Mucinex is the one that would replace would be comparable to the Ceoprose, I guess, in function. Mm-hmm. Except one has like really nasty side effects, I'm sure, and the other one is an enzyme.
Yeah, exactly. And the enzyme, I mean, Ceoprose, not only does it improve expectoration, it gets rid of the mucus, it breaks down and loosens the mucus, but there are also great studies on its ability to increase immune function to be able to fight off the infection too. So it does multiple things in that way, and it's a very unique enzyme. It's the only one of its kind that I've seen. And like I said, in pure form, it's very, very powerful.
Great. Really cool stuff. I've never seen that one isolated on its own in a product. I don't know if there's a commercial product of Ceoprose. Is there one you know of?
I've seen a couple of companies. I think not enzymatic therapy. What Allergy Research Group, is that the?
Okay. I have a lactoferrin from them.
Yeah, I think Allergy Research Group, or their sister company, is called Enzymatic Therapy, I think. Oh no, it's called Allergy Research Group, and I can't remember what the sister company is called.
I would guess if you search Allergy Research Group and Ceoprose, you might find something.
Yeah, I think they used to carry a Ceoprose S product. The manufacturer of Ceoprose, which is a company I used to work for, actually, Amano, it was always very hesitant to sell Ceoprose as a standalone enzyme because it's so powerful. For example, if you sold the pure crystals as a standalone, if someone inadvertently opened the capsule and breathed it in or got it all over their face, it would eat away at some of their skin. So typically what they sell is a diluted form of it, and it's better to have it in a blend than in pure form, unless you're using the drug version.
So smaller doses.
Smaller doses, yeah, but it's a great one to have in a systemic formula.
And for bank robbers.
And bank robbers, yeah, exactly. Yep.
Okay, keep that in mind, all the bank robbers out there. If you don't want your fingerprints found, just do some prints in the Ceoprose beforehand and let it melt right off.
Yep.
In case there's a rash of bank robberies in San Diego, I have nothing to do with it. And then we have papain. I've never heard anyone else ever say it out loud, so I don't know the proper way to pronounce it. But this is one of my favorites because it comes from papayas, and I like to eat papayas.
Yeah.
And I first learned of its existence because I went to a Brazilian steakhouse and ate my weight in grilled marinated meats. And then they brought out a papaya sorbet, for dessert. And
Wow.
the waiter, and I was in the service industry for 8 years. I never saw anything like this when I was doing it. And I didn't know these things when I was a server. The server explained papaya and the enzyme, and how when you eat way too much of food, like I had just done, that eating the papaya sorbet at the end of the meal could actually be helpful. And he said, makes it so you don't go home on your couch and turn into a bowling ball.
Yeah, exactly. And because you were at a Brazilian restaurant, you probably ate a lot of meat, right? Because they're all the Brazilian steakhouse, the gaucho style,
Yeah,
and
with the
papain is
swords.
yeah with the swords. I mean, I love that meat. Oh, and you
So
go
good.
crazy. Just keep that card on green and keep it coming. But papain, yes, like you said, it's from papaya. It's a very well-known enzyme. It is great at tenderizing meat too, so you can use it as a marinade in tenderizing meat. But it's also very good for digestion and very important for digestion as well. There's some good studies on its systemic benefits. It works well with bromelain as well. So in formulas where you find papain, you'll often find bromelain, and together they do work well together to help with joint pain and joint inflammation. And it's a perfectly safe, great for digestion and great for systemic anti-inflammatory as well.
Cool. And tons of research out there on that one.
Yeah, papain is well known and pretty well researched, and like I said before, and enzymes rarely work alone together. So I always like to see formulas that have multiple of these enzymes together, because they all do slightly different things or vastly different things depending on what system we're talking about. So in nature you would find more of a combination of these things in its natural state, and so it's important to see papain with the bromelain and trypsin and those kind of things together.
And preferably with like guys with swords and giant things of meat. I'd like
Yeah,
all of my
exactly.
papain to come with that.
Right.
I'd always heard of those places and I never went to one for a long time, which is horrible. And then I went and it was like, where has this been all my life? And I
Oh
think there's something psychological about all you can eat pricing,
yes.
because then you feel challenged,
Yep.
or, oh, I just spent, and it's weird. I've been to Fogo de Chao and Tejas de Brazil in various cities,
Yeah.
and the price for the dinner is not uniform.
Oh, really?
It's
I thought it was
completely
standard.
different. Nope.
Oh, okay.
In Vegas, it was $15 cheaper than it is in Chicago, and in San Diego, it's $10 more than Chicago. So
Wow.
I found that interesting. But when you're paying big top dollar for this dinner, and you can literally have as much of the meats off the swords as you want, the psychology is, well, I'm going to get my $57 worth, which is a plate like this of meat, and so the sorbet comes in very handy.
Yeah, exactly. Exactly.
Uh,
Another note on another fruit that'll help you digest, and there's an enzyme in this fruit, but it hasn't quite been commercialized yet, but kiwi. Kiwi has a proteolytic enzyme too that's very powerful. In fact, if you take little slices of kiwi, you can marinate meat with it as well to tenderize it. But if you've eaten a lot of meat, like a big burger, steak, whatever, and you don't have access to papaya, eat a kiwi. It'll help you with the digestion as well.
I figured that out on my own,
Oh,
actually.
you did?
One time
Okay.
I had kiwis around and I had heard some rumor of kiwi being used in a marinade or something. So I sliced up some kiwis and threw it on a flank steak. Well, I put a couple other things in there, but definitely there was 2 whole kiwis I threw in there,
Yeah.
and it definitely worked. It was very
Yeah.
tender. And regarding kiwis, I don't know how we got on this well, yeah, I know, but now we're talking about kiwis. I just recently learned that you can eat the skin of a kiwi. And so now I just lop off the ends and then cut it into slices, because I love kiwis and I never ate them
Yeah.
because they're a pain to peel and to deal
Right.
with. So you can eat the skin if a little furriness doesn't bother you. And that has reintroduced kiwis into my life. So hooray
Awesome.
for kiwis. Last one we have is lipase, and lipase is an enzyme that breaks down and metabolizes fat, correct?
Yep, Exactly. Yeah. And again, the word lipase itself is a general term for all enzymes that break down fat. There are very different types of lipases within the body. Your body makes different types of lipases. It targets different types of fats and converts fats into different types of fatty acids. And it's very important to have lipases within your gut itself because if you don't break down your fat, then in fact a high degree of fat within the diet that's not broken down can cause microbial disturbance, can cause peristaltic disturbance. You know, a lot of people, for example, if you just take a bunch of coconut oil and drink it, it's going to go through you pretty fast because it basically lubricates your whole system. So you want to be able to break down the fat, assimilate and pull out the fatty acids, convert it into triglycerides that are useful, and that's what lipase enzymes do. They basically convert fats into useful components. And then also a lot of people with reflux have a problem with breaking down fats, and so you tend to have fats that just kind of sit around in the small bowel, and then if you get gastric pressure and all that, it can push up. So you could take a lipase enzyme, actually helps quite a bit with reflux as well.
That's interesting. I never thought of that. But lipase you will find in digestive enzymes as well as systemic.
Yeah, and lipase, you know, there's not a whole lot of information on them being systemic. But as far as getting into the circulatory system and functioning in the circulatory system, however, what's important about them in a systemic enzyme formula is, you know, you want to clear out the fat that you have in the digestive tract, and so that there's room for the other systemic enzymes to actually be absorbed. You know, if you happen to have you know, undigested fat and things like that in the digestive tract, it'll bind up your other proteins, and you may not get the benefit of it. So I don't mind seeing it in a systemic formula. I think it's a very important digestive enzyme, but it's overall just beneficial. So if you have problems digesting fat, meaning your stool is, you know, and you could tell people with fatty stools, they tend to have kind of an oily appearance to them, or if you get GERD and reflux, lipase is very important for that as well.
Okay. That makes total sense. So it's not like you can just take lipase though and it melts all the fat off of your body, correct?
Yeah, unfortunately, it doesn't do that. Yeah.
What about fatty liver?
No, you know, I've never seen any research with fatty liver and lipase.
Okay.
In industry, just as a side note, interestingly enough, lipase is used for two things. I used to work on two different things with lipase enzymes. Number one is in drug manufacturing. So lipase actually is a great way of separating chiral enantiomers of drugs, which what that means is not that important. But the second part is in cheese. Certain types of lipase enzymes can modify the flavor of cheese. So there's something called enzyme modified cheese, and they use lipase enzyme to basically change the characteristics of the flavor of certain cheeses. So they're very important for breaking down fats that come from dairy and all that. Okay. You know, and historically humans, our lipase production just goes lower and lower and lower as we age. So it's important to supplement with it.
That's why older people often say they have trouble eating fatty foods, probably.
Yeah, you know, and they get a lot of reflux and indigestion because they're not breaking down the fat.
Interesting. All right. Well, that's the whole list that I have. I really appreciate all the information, and as always, you sharing so much of your knowledge. And enzymes, the more that I learn about them, the more I think that, like I personally I've been using a combo product, Wobenzyme. I'd also used Vitalzyme. Both of those products, they contain, I'd say, half to 2/3 of the ingredients that we've discussed during this interview. I've seen pretty good results with both of them, generally at pretty high doses though. But for shoulder injury really helps me. For back pain, it was helpful. But now that I'm learning all these other values of, you know, the superoxide dismutase, the serrapeptase, nattokinase, which those three are not in either of those products, I don't believe.
Right.
now, I mean, I think it's something that personally I'm going to include as part of my everyday regimen, even if it's just a low maintenance dose, because our overall body's production, I mean, I'm 35. And so depending on where you are in life watching this, you either consider 35 like a young pup, or you're like, oh my God, 35, that's so old. Remember those days?
Yes.
When you thought 35 was like your old
Yes.
uncle? And our enzyme production as a whole decreases as we age, like across the board, right?
Yeah, basically, yeah.
So including a really well-rounded proteolytic enzyme blend is something that, you know, as a health conscious person, I think I'm going to do for myself. And it was brought to our attention by you, actually, and you have no affiliation with the company whatsoever, but they make Fibrenza, and Fibrenza is a proteolytic enzyme blend that's pretty new on the scene and the market. And it does include all the enzymes that we discussed today. And it's the only one I've seen that does. And so I was taking Wobenzym and serapeptase and nattokinase together, and like 3 products. And so for me, I've replaced 3 for 1. And that's kind of what gave me the idea to put these interviews together in the first place, was so that everybody could understand, because what I've seen with the proteolytic enzymes with myself and clients and colleagues has been pretty remarkable. So
yeah,
I really appreciate the time, Kiran, as always, and sharing all this information. And we will, I'm sure, record another webinar interview or something coming up. And if you haven't, you enjoyed this and liked it, check out the microbiome series, like I mentioned at the beginning. Great content there, mostly gut related. We do have an episode there about microbiome and enzymes specifically, what's produced where and which bugs produce what and how it all works together. So if you're interested in that, check it out. Just sign up as a free member on the site and you'll have access to those. So thanks again, Kiran, and we'll talk soon.
Thank you, Mike. Take care.